latest COVID-19 case in Wichita County, fear is causing people to limit their exposure to the outside world, and that includes the hospital. Hello, thanks so much for joining us. I'm Daryl Franklin.
And I'm Melanie Townsend. I went to United Regional earlier today to see how they're stepping up their screening process so people can feel more at ease when they need to seek treatment. While emergency rooms in bigger cities are being backed up with patients showing signs of COVID-19, things at United Regional are relatively quiet nowadays, which is a good and potentially bad sign. United Regional's trauma director, Dr. Brett May, says people are forgetting there are still things to worry about outside of COVID-19.
People still have heart attacks, people still have strokes, people still have appendicitis and surgical emergencies, and we don't want you staying at home with those things going on because things are only going to get worse.
United Regional has also created several ways to screen for the coronavirus and keep patients separated as much as possible.
When somebody comes into the hospital now, we immediately screen everybody, whether they're a patient, a visitor, or a healthcare provider. I get screened every day when I come into the hospital. We have entire floors and ICUs that are isolated for those patients that are at risk of COVID.
Last month, a local physician predicted to city councilors that hospital beds in Wichita Falls would be overrun by April 25th, and all ventilators would be taken up by April 19th. But Dr. May says they are fully prepared to handle this outbreak.
One thing that people need to recognize is that we deal with infectious disease processes all the time. This is not something new for us. We have a year-round stockpile of PPE that we keep. From a testing standpoint, we are one of the top counties in the state in our ability to test. Everyone that's come into United Regional has been treated, has recovered, and has been discharged.
As long as we continue carrying out important health practices, Dr. May is confident this community will come out on top.
I think Wichita Falls is doing great. I think from a community standpoint and a healthcare standpoint, we can be held up as a model to anyone in the country.
Well, United Regional has also set up a triage tent out in the parking lot of the ER, and COVID-19 testing is being held in front of their clinic on Barnett Road. Now, later this afternoon, United Regional also released a video giving members of the community the confidence to seek treatment at the hospital without the fear of the coronavirus. Here's a brief look at that video.
Hello, I'm Phyllis Cowling, President and CEO of United Regional Healthcare System. I've been made aware recently of situations in which local residents who needed urgent or emergent care were hesitant to come to the hospital because they thought it was unsafe, that the presence of COVID patients would put them at risk. Nothing could be further from reality.
Now, we have the entire video plus the previous story online right now on Texomashomepage.com.